Hello, it's Abigail reporting. Not many people talk about toxic traits in the medical field since they are supposed to always be happy and influence the trust of a patient. Like you don't go to the doctor and see them in any way they mean useful to the organization with no concern for the actual person. There always be another way, another you. Don't forget you are easily replaceable. Which is funny because you went all the way to medical school, end up like this, killing yourself to like till death, studying for finals for someone to end up in a workplace that is the same as retail but they pay you more. So I guess it's worth it, the mental health exchange. In the article, Time to Face the Truth, Healthcare Workplaces Are Toxic, by the website WordPress, we can see that fear-based leadership, it is less common to see doctors who are not happy or trying to see how they can help patients who live under a bad environment unless you are living with them. The workplace for doctors and nurses is hard, but mainly for nurses because they are the ones interacting the most with the patients, since they are the ones that give them the vital signals and things like that. Nurses often get treated as less by patients or other departments. As we can see, healthcare work environments, employee satisfaction, and patient safety, care providers' perspectives by the Charlie Rahier and Douglas Armey, experts that are concerned about the lack of satisfaction and turnover among nurses. I cannot imagine a nurse being real like, yeah, let me get your vitals, and then yeah, they're bad, you need to see the doctor, just wait. Like, no. Nurses don't do that. Nurses are usually like try their best to be like kind and nice, and not every patient treats them the same way. There is a lot of work put into the career to have a work environment where they are not going to be happy about their health, like, which is mainly about the mental health because it gets exhausted for them. It is just like working with a grown group of kids who don't like to eat their veggies or won't respect you if you don't look like an adult, or like that you can do things just like a doctor. Just like in the emergency rooms where there is more attention needed and found more people and substances that can harm the nurses.
Association reveals a shocking statistic. 1 in 4 nurses will experience verbal or physical violence in their career. The majority of these violent attacks occur in the ER. Nurses have been punched, scratched, and even assaulted with weapons. In one survey, nearly 20% of nurses said they were afraid to report their attacks in fear of losing their job.
Many drugs can enter and kill a nurse in the main desk, or the people in the main desk, or harass them. It is like, I study for a lot to become this person to help the people, like my community where I grew up, or someone who has less knowledge than I had come towards a person like a nurse or a doctor and tell them, oh, you don't know what I'm doing, you should not tell me what to do. And that's why you go to the doctor, to get a review of your health. You are the one causing your issues. Of course, it's like environmental problems and policies and a bunch of other factors. There is also a burnout for doctors and nurses because they have been in this same place, and short of staff can lead to overworking the staff they currently have, leading them to a burnout. The above table 1 It has been observed that the results of convergent validity of the constructs of TWE, EE, JP, and SHRP are mentioned as A. All values of factors loading are greater than 0.60 standard value. B. Average variance extract ABW reliability CCR are greater than 0.70 threshold, which illustrates that all four factors SCFA meets the standards of convergent validity, showing that the nurses have more likelihood of emotional exertions due to their job environment, and which leads them to have a lower performance in their job. I think it's better to create policies where HR can actually do something to help the employees in the medical field when they feel emotionally exhausted. So next time you go to receive a report on your health that you don't like, don't get mad at the doctors and nurses. They're there to help you out. And I'm sure they already had a exhausted day from walking around and seeing people with many issues and different problems who aren't happy. At the end, we are the ones who blame on our lives, and we shouldn't go around getting our anger on workers who are there because they need money. I mean, we all work to help communities, but then also because we need the money. Thank you.